Hi, and welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat. On this episode, I am talking with Andrea Wetterau. She is a mother of two and a therapist specializing in pregnancy, postpartum, and early parenting, specifically to empower people on their journeys towards healing from trauma and finding peace with their relationships with food and body. And in our episode today, we are talking about eating disorders and trauma and perinatal mental health and the intersection of those three things, amongst other stuff. We dive into what negative core beliefs are, ways that people can find healing for their relationship with their body and with food, and the ways in which having an eating disorder history or current eating disorder or difficulty with body image might be impacting your perinatal mental health journey now. So let's dive into this really important conversation with Andrea. Welcome, Andrea. Thank you so much for being here.
Thank you for having me.
I would love for you to start off today with just some of your personal story and maybe some of why you're interested in the things that you're interested in, and helping other people. And then, of course, really want to dig into the work that you do.
Yeah. When I was 16, I was diagnosed with anorexia. And there was this really pivotal moment in my treatment where I knew I had to dig deep and find reasons to get better because I couldn't find reasons to get better for myself. And the two reasons I could really think of in that moment was I wanted a career where I helped people. And the second was I knew I eventually one day wanted to be a mother, and
Mm.
an eating disorder really does impact one's ability to get pregnant. And so like those were kind of my driving forces. And fast forward like 10 years later, I was an intern at an eating disorder treatment facility. Eventually went on to work at another nationally known eating disorder treatment facility. So a lot of experience working with eating disorders at higher levels of care.
Mm.
And what I noticed in my job was seeing a lot of parents coming in and out of treatment. And I think like coming from having experienced an eating disorder as a teenager, I my main goal was to go into working with teenagers in eating disorder treatment. And then I noticed I was really interested in the
Mm.
parents that were coming in and out, and the themes that I was seeing. And a lot of people, there was an onset of an eating disorder or even a relapse of an eating disorder when people were in the perinatal period.
Uh-huh.
And so I really wanted to pursue that. And this was before I even became a parent, but I was really interested in understanding like what was happening in that time
Right.
that led to the need for this essentially this coping skill, right?
Hmm.
It's helpful until it isn't.
Hmm.
Um, and and so then I went on and I got trained in eye movement desensitization and reprocessing. I wanted to get trained in some trauma work because a lot of what's with eating disorders, it's underlying trauma.
Right.
And then that same year I went and got trained in maternal mental health. I got certified through Postpartum Support International. So really just combining all of this work together. And the primary population I work with is pregnant and postpartum people,
Hmm.
and also parents, in being able to really heal trauma and also be able to find peace in their relationships with food and body.
Right. Um, I mean, I since this is your specialty,
Mhm.
people are coming to you for where these things intersect, the
Yeah.
eating disorders and perinatal mental health and trauma. I would assume that it's more prevalent than people think it is.
Absolutely. Yeah. I mean, when you think about eating disorders, they just have high comorbidities with depression, anxiety, PTSD, OCD.
Mm-hmm.
We're seeing higher correlations with ADHD, ADD,
Mm.
right? And so there's eating disorders are a way of coping with a lot of times undiagnosed other things. And as well as I do, like at least one in five people
Mm-hmm.
experience a perinatal mood and anxiety disorder. And so you just think about how frequent struggles with food and body that are also happening that aren't being talked about.
Right.
Hmm.
And I mean, you mentioned your experience with anorexia, and I think that's maybe one of the more kind of known eating disorders, but what
Mhm,
are other types of eating disorders that
mhm.
that people are struggling with during this time?
Yeah, so I mean, anorexia is associated with restriction. Uh, Bulimia is associated with binging and purging. We also see binge eating disorder, which is just uh, the episodes of just high calorie food intake. Um, Orthorexia is a really common one. I think, especially I live in Seattle,
Mm.
and there's just health focused people, and I think it's when people don't realize, and when we take it to that extreme, it's also unhealthy. Um,
What
because
is
I think
it for
orthorexia
people
is
who
like
don't?
is perfect eating.
Mm.
It's perfect eating, it's perfect exercise, um, and I think it's all in the name of being healthy. And at the same time, an eating disorder, when we think about um, like meeting diagnostic criteria, it's how much does it impact our day-to-day functioning. And orthorexia, I think a lot of times, I think it's important to recognize how distressed someone can get when they realize they might have eaten something that maybe they considered bad, and I say this in quotation
Mm.
marks, right?
Mhm. Mhm.
Or if they miss a workout that day, it's the distress that is a huge sign of that maybe that relationship with food and body isn't healthy.
Mm. Yeah.
Yeah, so I think those are kind of ones that and then I mean, there's also avoidant and restrictive intake disorder. And I'm not as experienced in that one, but that is a lot to do with like sensory, and just like different
Uh,
textures of foods and stuff like that.
so, if are there other ways that people are experiencing like difficulties with relationship with eating or food that's not quite, I don't know, like meeting diagnostic criteria necessarily, but is impacting them?
Absolutely. And so I think it's kind of looking at the spectrum of like balanced healthy eating on one end, and then eating just like diagnosed eating disorder on the other, and then there's this whole continuum in
Mm.
between, right? Where I think it's just recognizing again like how much is the focus on food and body impacting a person in their day-to-day life. Are they not going to a party because they don't want to break their diet
Mm.
or eat foods that they shouldn't quote unquote be eating.
Mhm.
I think it's kind of just going in there of like how much is this impacting your quality of life.
Mm.
um
Right. So
yeah.
if there's not really I don't know, super visible outward signs, let's say,
Hmm.
or super outward visible behavior changes that, like,
Hmm.
let's say other people would be able to notice, like, something might be going on with them. Are there a lot of internal processes, like
Hmm.
internal struggles, things that nobody would necessarily see or notice or be aware of?
Hmm. Absolutely. I think that a lot of times what I see with people are food rules. And sometimes these are unconscious, sometimes these are passed down from our parents, from our
Mm,
grandparents.
mhm,
And it's just being able to recognize like what guidelines are you going by in a day. Like for
mhm,
example, food rules might
mhm.
be don't eat past 7 p.m.
Oh,
Other
okay.
food rules might be like drink coffee before breakfast to suppress your appetite, right?
Mm,
Like it's a way of having control.
mhm,
Um, Other things that you might not be able to see on the outside is negative core beliefs. That's a
mm,
huge one
mm,
that I see in my work. And I can get back to that in a moment. And
yeah,
other things too is like negative body image. How often are people body checking, which could include like looking at their reflection when they pass
mm,
a
mm,
reflective surface? Are they pinching their body in certain parts, right? Measuring,
mm,
um, yeah, things that people around them might not necessarily see,
mhm,
but definitely could be red flags for someone if they are aware of them. When it comes to the negative core beliefs, um, the EMDR that I'm trained in with Roy Kiesling is we really talked about, well, and a part of EMDR is you look at what is the negative core belief that was present in that stressful or traumatic event,
mhm,
and looking at, because like when we experience a traumatic or stressful event, we perceive it through our senses. Then we kind of connect it with an emotion or body sensations, and
sure.
then eventually we're able to put words to the experience. And a lot of times it includes a core belief because it's an emotional understanding of why this happened to us. Um, and so like negative core beliefs could be like, I'm unworthy, I'm bad,
Okay.
I'm not enough, I'm unlovable.
Mhm.
Um, and so I think, or I'm too much. And just kind of think of an example of, let's say a child is crying and is really upset and the parent tells them to go to their room. The the child may then interpret like my emotions are too much,
Mm.
and if there's like repeated experiences of this, they might then try to kind of like push their feelings down, and maybe that would include numbing, with binge eating. Maybe it
Mm.
includes like feeling like they need to find some sort of control through restriction. Um, but the eating piece, the food and body piece, I think is a way of coping with these negative core beliefs that we hold. And what I've seen in my work with pregnant and postpartum people is, I don't know if you're familiar with like Cheryl Beck's work.
Some.
Um, yeah, and so she has a lot of work on the little T traumas,
Mhm.
and and her three things were what it, and her specific ones were with childbirth, and so those three things could be perception of lack of caring,
Mhm.
which could include feeling abandoned, stripped of dignity, lack of support, and reassurance.
Mhm.
The second one is poor communication. So they may have felt invisible, not heard, not important. And the third is feeling of powerlessness. So a betrayal of trust. Didn't feel they could. Didn't feel they were protected by staff, and they felt they had a lack of control. Um, and when I heard that this piece in my perinatal mental health training, I think that really struck a chord with the training I had just done with EMDR. Was like,
Mhm.
I'm hearing a lot of negative core beliefs here of feeling abandoned, feeling invisible, feeling unimportant, feeling powerless, feeling like they can't trust, feeling like they need control.
Right.
And so I really wanted to connect those things in my work. And so when I'm working with pregnant and postpartum people, I really am paying attention to the negative core beliefs I'm hearing,
Right.
and trying to connect it then to like what they're experiencing now, but also where does this negative core belief come from, and could we tend to that piece too? um
Sure. Well,
yeah,
I mean, just has to be incredibly complex.
it is, yeah.
When you're talking about things that were incredibly impactful, maybe in childhood or at some point along the way,
Hmm.
um, and let's just say um, somebody who when they were younger in their teens or something had an eating disorder, got help for it, we're doing okay, coping fine. But then
Hmm.
pregnancy comes along, and this like a whole new batch of stuff comes up
Hmm.
to consider or to deal with. Um, that just, I mean, that's one scenario. I'm sure there are many others, but it the complexity of that, of like
Hmm.
feeling like, oh well, I thought I dealt with this already, or
Hmm.
not expecting to have to deal with stuff again in this new context. It's just tough.
Hmm. Absolutely. I mean, the National Alliance for Eating Disorders has said that 16% of pregnant women will have experienced an eating disorder at some point in their life,
Mm,
and 50% of those people will relapse within a year of delivery.
mm.
And I'll even share a piece of my personal story.
Yeah, thank you.
I mean, I felt really strong in my recovery going into my first postpartum, um, or in my first pregnancy at least, and then I experienced pretty significant birth and postpartum trauma,
Mm,
and I think I just kind of tried to push myself past it. Like, I'm fine, I survived it, we're good, um, and went back to work. And I worked across the street from where I gave birth, doing group therapies where I could see the childbirth center out the window, right? Like,
yeah.
and I'm thinking like, "Oh, I'm fine. I should be fine." But I wasn't. I
Mm,
was having pretty severe PTSD um, reactions at work,
mm,
and then I really struggled with uh, perinatal OCD. So like the intrusive thoughts were really really
yeah.
scary, and I eventually had to take a mental health break from work, and I
Hmm.
just remembered feeling so ashamed and
Yeah.
embarrassed because I felt like I'm a strong person, I'm an amazing therapist, I should have been able to do this on my own. I
Mm,
had a
mm,
therapist,
mhm,
but she wasn't a perinatal mental health therapist, so
mm,
I think she really felt limited in being able to help me. Um, But I took a mental health break from work. We had my daughter stay in daycare so I could take time to take care of myself. And when my husband was gone at work during the day, it was just me at home. And I just felt so lost at like what to
Yeah.
do with myself. And that little eating disorder voice came calling. It was just like,
Mm,
hey, like
mm,
if you skip lunch today, no
mm,
one would know.
mm,
And you would feel so much better. Like you would feel like you have some control right
mm,
now. And I felt that, and I felt the urge to not have lunch, like, thinking, like, "Oh, maybe that would help me feel better because it's like, I feel maybe, like, empowered in
right.
something, and but I also knew that that would take me down a road where there may be no coming back, and
Sure.
and so I forced myself to eat lunch that day, and I forced myself to eat lunch the next day, and
Mm,
a real effort to make sure that I continued to eat every single meal because I
mhm.
knew that if I restricted one, that was a slippery slope.
Sure.
But I also knew in that time it was like, oh, that my eating disorder. I'm also trained in internal family systems
Mm,
therapy, and just so looking at that as like this protective part of me that just like so badly wanted to help me feel better,
yeah.
and it wanted to protect me from this pain.
Right.
Um, and I'm just really grateful I had access to other parts of myself to be able to recognize, like, that wasn't the answer.
Right.
Yeah.
Oof. Well, I mean, you listed several types of therapy that are incredibly helpful, and it's great to be able to have that to pull on, like
Yeah.
go therapy. It's just
Yes.
everybody
Yeah.
go. Um, that's great. And for people who haven't yet had that type of support or therapy or healing and recovery,
Mhm.
I mean, they're just in it, I assume,
Yeah.
just
Yeah.
not kind of like grasping for control or wanting to figure some way how to cope because it's so emotionally painful.
Mhm.
It's
Mhm.
a
Y
lot going on.
yeah, and, I mean, I would say if anyone's really looking for that first step in getting support in their perinatal experience, because 'cause I've heard people ask, like, "Well, should someone find a therapist in perinatal mental health? Should someone find a therapist with eating disorders?" And I think or trauma, and I think, the first step is perinatal mental health. Like if they could get onto Postpartum Support International, look up that directory, find someone certified in perinatal mental health, that is a huge difference. I mean, like I said, I had a
Mhm,
therapist established for over a year when I was at this really low point in my
mm,
life,
mm,
but she wasn't trained in perinatal mental health and she could
right,
only help me so much. And
right.
when I started working with someone who understood and was trained and experienced in what I was talking about, it just completely changed my my, my life, really, right? Like,
Mm,
I think, like, having someone be able to not be afraid of the things that I'm talking about, and be able to, like, validate it and give me hope,
mm,
that was huge, and I think, like, when it comes down to the ways of coping, whether it is through food and body, I think for a person trained in perinatal mental health, I would like to think that they'd be able to take it back to that, right? Like, oh, like you're really focused on how to control your
mhm,
weight
mhm,
right now.
mhm, mhm.
What's happening for you on a deeper level, right? Like, um, and just working on that piece of what it's really about because it's rarely about just the food and body.
Right, can we talk about the body image specifically? Just
Hmm.
because it's so I mean, there are just such huge body changes,
Yeah, yeah.
from, the beginning of pregnancy all the way through to the end, and, what are some of the things that you see people struggle with just in terms of body image?
Hmm. Um, And I think I bring it back to their negative core beliefs. So,
Mhm,
for example, like in pregnancy, if they're saying, "Oh, like I'm gaining so much weight," I love to ask the question, "What does it mean about you as a person if dot
mm,
dot dot?" So it's like,
mm,
okay, what does it mean about you as a person if you're gaining weight?
mhm.
And they'll be able to say like, "Yeah, I'm gaining weight for my baby, but also like I feel like I'm putting on too much weight and I feel lazy." Okay, what does it mean
Oh,
about you as
mm,
a person if you're lazy?
mm,
It means that I'm weak. Okay, what does it mean about you as a person if you're weak? And we kind of just keep pulling that thread until we get to a lot of times it's like I'm unworthy, I'm unlovable, I'm bad. Right. And so it's just really getting to the core of it. And I think also in postpartum, if someone's really struggling with body, it's again, what does it mean about you if you
Mhm.
haven't lost the baby weight?
Mhm.
And just pulling that thread until we really get to that core belief and starting there.
Mhm.
Um, and I think also a theme that I've seen with people, when you think about eating disorders, it's like chasing that number on the scale
Mm.
of when I get to this weight, I will be happy.
Mhm.
Okay, I'm at that weight. I'm still not happy. Let's try this weight.
Mm.
And it's just trying to find something with through that number on the scale. And I see that with people in postpartum where it's like if I when I get to my pre-pregnancy weight, I will feel like myself again.
Uh,
And then they get to that pre-pregnancy weight or pre-pregnancy clothes and they realize they're not themselves, they don't feel like themselves. And that's a really great area of work that I do as well is like, okay, let's rediscover you because
mhm.
you're not the same person you were
Mhm.
before you became a parent.
Right.
And so it's just really looking at like I like to think of it as like the food and body piece as like a starting point and just like
Mhm.
a direction of where to pull the threads and get to the root of it.
Oh, absolutely. I mean,
Yeah.
and as you were saying that like pre-pregnancy weight thing, it kind of pinged some thoughts for me about how much pressure there is societally,
Yeah.
of like these ideas about getting your body back, and even pre-pregnancy weight as a goal, or all of these ideas that add this other layer of complexity to the
Mhm.
process that I don't know, just kind of have a seeped in to all of
Mhm.
us in some way or another.
Absolutely.
Like it's
Mhm.
dealing with whatever this idealized version of a pregnant person looks like. Um,
Mhm.
even if to get more specific, like a pregnant woman
Mhm.
is quote unquote supposed to look and be a certain way, and it's
Yeah.
ridiculous. But like this,
Yeah.
I whatever that I idealized model of that person is just so not real.
Right. Absolutely. And I think that's when it's like that black and white thinking of either the person is doing it perfectly or
Hmm.
they're a complete failure. And that just sets up the majority of people for feeling like a failure,
Hmm.
um, because there is no perfect process um, in weight gain and loss in pregnancy and postpartum. Um, but I think like that piece too of that hyper focus on weight
Hmm.
in pregnancy and postpartum or in pregnancy is very activating for people, right? There's
Sure.
people in recovery who haven't weighed themselves in years
Yeah.
and then they get into their OBGYN or midwife's office and they're like, "Oh, they have to get weighed."
Mm.
And even if they do a blind weight, or, where they have their back to the number,
Mhm.
it still can be activating to know that someone else knows that number.
Right.
Um, and sometimes it's put on the printout and then they accidentally see it. So
Hmm.
I think and I think for me, looking back on my first pregnancy, while I did feel strong in my recovery, I think like my perfectionist part came out of like, I'm going to gain weight perfectly to to ensure that my baby will be healthy,
Mm.
and to ensure that I will be healthy. And because I think I wanted to make sure I was gaining enough too. Like I didn't
Oh,
want
okay.
to, yeah. Um, and then with my second pregnancy,
Mm.
I didn't even want to know the number on the scale. It's like if I'm
Hmm.
healthy and my baby's healthy, that's all I
Hmm.
need to know.
Hmm.
Um, yeah, I think of
There's,
that. Yeah.
I mean, you're making me think of a couple of different people that I met with a while back, where one person who did have a history of an eating disorder would go into the OB's office, and um, the client who was pregnant wasn't really gaining much weight, and the
Hmm.
OB was happy about that and sort of
Yeah.
applauding them for it, and like even getting that like positive reinforcement of like you're doing a good job of not gaining weight.
Yeah. Yep.
How I mean, I don't know if the OB knew or not that there was a history of an eating disorder, but whew, um,
Hmm. Hmm.
man, just even just a doctor's message like that is tough, and we're getting
Yes.
messages like that from other people too. But
Mhm.
how challenging that can be to one either be being told like, oh, you're gaining too much weight, or you're
Yeah.
not gaining weight, so that's great, or you're not gaining enough. It's just it's
Mhm.
I'm there's just at every avenue you're like kind of going down, there's potential to be activated in some way.
Yeah, yeah. And I mean, I would say pregnancy and postpartum, it seems like that's like one of the times in a person's life where other people in their life, including strangers, think that it's okay to comment on their
Mhm.
body,
Right,
right?
right,
Or
right, right.
even touch their body. Right? Like,
Mhm,
and so just I think like that also could feel so vulnerable for someone. Like when you were talking about the societal messages of
mhm,
what society expects people
mhm.
in terms of getting back to pre-pregnancy body. I think it's also um it's so vulnerable because there's this it's other people are also focused on your body, right? Like
Yeah,
maybe
yeah.
other times they're not really you don't feel like people are paying attention to your body changes, but here in postpartum it's like, oh, people are like looking at me
Mhm.
to see what happens over the next year, right? And I think
Yeah.
that feels so um raw
Mhm,
and frightening, I think, for people of like, what are they going to think about me?
mhm,
But again, I use that as the thread of, okay,
mm,
what does it mean if they think that about you?
mhm,
And we
mhm.
just keep going until we get to that core belief again.
So once you do get to that core belief, what are some of the ways that you help people the with those? I
Mhm,
understand through
mm,
EMDR. Um,
mhm,
mm, but like it's your there that's a relationship with themselves that they're really
mhm.
conflicted about.
Yeah, yeah. Um, I really try to use maybe internal family systems therapy. So it's identifying like what is the maybe where do they feel that belief in their body? We identify what's the protector part that's present. We kind of get in touch with that protector part, and then we update that protector part because
Mhm,
a lot of times I think Dr. Becky said this so beautifully in one of Glennon Doyle's podcasts about how when we develop parts, they kind of stand around us like shields of armor,
mm,
but they never look inward at us. They're always looking outward, and they think that we are the same age that we were when they started their job.
right.
And so it's about turning them around and letting them see you at your current age and being able to
Mhm,
update them about what your life really looks like now that you're no longer at that age, what's happened over the years. And a lot of times, even just that piece, it helps that protector part relax or ease,
mhm.
knowing that they don't have to work as hard
Right,
anymore. Like
right.
that original threat may no longer be there. And I think similar with EMDR, it's, we use the bilateral stimulation to kind of retrieve the memory from the hippocampus, getting it into working memory and updating it again with recognizing like, okay, what happened in that time? Can we update it with what you know now? And then we
Right.
can store it back. Um, and so, yeah, it's a lot of, I do a lot of somatic work.
Mm,
When we think about our trauma responses, we have top down, which starts with like an unhelpful thought, and then it hits the emotions, and then it gets to the body sensations. But the majority of our trauma responses are bottom up, which is like we perceive it through our senses,
mm,
then our emotions respond, and then we
yeah,
get the thought. Um, and so things like cognitive restructuring can be helpful sometimes, but when that response starts in the body, the cognitive restructuring or the CBT uh, techniques really can only get so far. And
mhm.
so it's really important to get into the body and start with some somatic therapies. Yeah, yeah. So I mean, we've talked a lot about yeah, what are ways that we can recognize um, the negative core beliefs or food rules or food judgments or struggles with body image that we hold. And that's like really that first pivotal piece in being able to create new patterns
Mm,
is recognizing like what isn't working anymore. A lot of times, like what was given to me from previous generations that really isn't working anymore.
mm,
And then I
mhm,
don't
mhm,
want to pass on to my kids.
mhm,
And and so I think it's about being able to recognize what isn't working, what you don't want to continue, and finding new, more helpful, more balanced ways of moving forward, not just for yourself, but also for your kids.
mhm.
Um, and intuitive eating, the that practice is something that we've been using in the eating disorder treatment world for quite a while, and and I would say it's just a fantastic approach. There's an incredible book. I believe it's by Evelyn Tribal and Elise Resch, and they have kind of like their 10 core steps of doing it, and they really give an example, setting examples for each of like, how do you stop the dieting? How do you
Mhm.
learn to trust your body? How do you recognize your own food judgments? How do you create a healthy relationship with exercise? How do you care for the here and now body and not for the body down the road, um, or the body that you once had?
Right.
Um, and also, like, how do you raise intuitive eaters? And an intuitive eating really is, it's about reconnecting with yourself, with your hunger fullness cues, with your desires for movement, with your body, and just, I think, with a lot of curiosity rather than judgment,
Mm.
and then being able to create new cycles for yourself or new behaviors. Um, and it's just a very powerful practice, and I highly recommend and that book to anybody.
That's great. Thanks for kind of breaking down what intuitive eating is.
Mhm.
That can be really helpful to know that there are kind of ways out,
Mhm.
so to speak. Like
Yeah.
if somebody's been off and on dieting their whole life, uh,
Mhm.
going from that to like how do you shift that? How do you change that? How do you have a different
Mhm.
relationship with food, that kind of a thing? Can be hard to even
Mhm.
fathom. Like, how do I not diet?
Mhm.
That's just what I've done, that kind of a thing. I
Yeah.
think that is true for everywhere on the kind of spectrum of eating
Yeah.
disorders, right? Like
Mhm.
dieting or relationship with diets and food happens across the spectrum of um,
Mhm.
eating disorders.
Yeah.
Um, just like being able to check in with your own body and trust your own self is a big
Mhm.
big step.
Mhm. Yeah, I mean, when you look at children, I would say that the majority of children are intuitive eaters.
Mm,
Where they move their bodies with joy. They eat when they're hungry. They stop when they're full, um, and there's no uh, emotion attached to their food choices.
mm,
It's really just what they are feeling hungry for in the moment, um, and um, but they lose that, right? They lose that over the years from messages from society, from their families, from
for sure.
friends,
Yeah.
right? And so then they lose that ability to be in touch with themselves, and they start listening to external
Hmm.
messages.
Hmm.
And I think intuitive eating is a practice to just reconnect with yourself and to be able to reconnect with your own hunger fullness cues, your own internal
Hmm.
signals. Um, And yeah, and I think something I've seen too with the parents I work with is like they get really activated by their toddlers eating, right? Or even their babies eating, where if they feel like they're not eating enough or they're eating too much or they
Hmm.
should be eating these good foods and not enough of these bad foods, and or they should be eating more good foods and too much bad foods, um and I really like to look at those, like really hone in on that work too, because it's that what's happening with their child is really activating something within themselves, and it's like they're trying to learn how to trust their child's body when
Mm.
they may not even trust their body yet,
Ooh,
right?
yeah,
So,
yeah,
yeah,
that's tough.
yeah,
Oh, well, I
yeah,
imagine for somebody who's like anxious or
yeah,
worried that oh, that would be hard. I mean, you're while you're all feeling anxious and or dealing with your own stuff, you're also trying to, you know, be the best parent that you can be. And
yeah,
what is that if you've learned
mhm,
that being perfect is like what's right? And oh,
mhm,
it's really, I mean, I've used the word complex several times, but it is. It
yeah,
just the it's an incredible amount, especially for people who are in the healing process and are
mhm,
know what's going on and are trying to like be in touch with their their own thoughts and their own feelings, and to at the same time be aware of what's going on with their child. There's just so much mental and emotional processing at the same time,
Mhm.
also exhausting. Um,
Yeah.
so
Yeah.
yeah, I guess for I mean, what would you say to people who are out there currently like hearing this and currently dealing with these struggles?
Mm. With all the struggles we talked about or just with the children, like the kids eating?
Oh, the kids eating first,
Kids
I
eating.
guess.
Yeah, yeah. Oh, I mean, I just wanna validate how hard it is to trust your child's body when you grew up learning that you could not trust your own.
Mhm,
Um, and how, like, by, I think, staying patient and reflecting before reacting,
mm,
that they can create new patterns moving forward for
mm,
themselves and their children, right? Like,
mhm,
they're giving their child the space to be curious about their own body and
mhm,
their hunger fullness cues and what they are hungry for or not hungry for. Um, Whereas, like, they may not have gotten that space, and so it's hard to be the cycle breaker. It's really hard.
mhm,
They don't
mhm.
have a roadmap.
Right.
They're kind of just going with what they feel like is best, and it's also, like, doing what didn't work for them as a child, and
Mhm,
so I really wanna give so much, credit and send so much love to the cycle breakers in this
mhm.
generation that are doing this work, not only of, like, helping their children have healthy relationships with food and body, but also to reclaim their own relationships with food and body.
Oh, that's beautiful. Well, thank you for this today. I know it's going to help a lot of people who are looking for this kind of help and healing.
Thank you so much for having me. I appreciate it.
Please connect with Andrea at wetterowellness.com, and you can also find her on Instagram at nurtured and embodied mama. And please do share this episode with anybody who you think could benefit from hearing this information. These things are really hard to sometimes know that we're going through them themselves. So, hearing them from somebody else or hearing somebody else have a discussion can be a really important way to empower somebody to find their own healing. And to that end, please make sure you are subscribed and are following the Mom and Mind podcast on whichever platform you listen on. And while you're there, make sure to give us a star rating. Those ratings help a lot, and make sure that people who need this kind of support can find this kind of support through the Mom and Mind podcast. Thank you so much for being with me. Until next time.